Hello, everyone, and welcome to our afternoon session, and actually our last session before closing the Digital Health Society Summit. Very important topic and topic dear to my heart, and I think it's very important for all of us. Advancing women's health, addressing Techquity, SDGs, and international policy regulations. I'm joined here today with the three fantastic speakers and champions of women's health coming from different parts of the world. Irene Aninia, who is Chief Science Officer at Society for Women's Health Research. Caroline Harris, Labour Member of Parliament for Neath and Swansea East, joining from the UK. And Esther Reuter, Business and Partnership Manager at Africa Health Business, joining us from Kenya. What we will be talking about here and what we will be exploring here today is we want to focus on advancing women's health through the lenses of technology, technology equity or Techquity, the UN SDGs and international policy regulations. And we want to talk how we can actually make sure that we advance women's health with the technology and not create new gaps and new inequalities. I will let my speakers to introduce themselves by telling us what brought them to women's health domain and why was there any specific moment in their career that was decisive and made them very eager to work on this topic, or is there something else that make them passionate about, or maybe not passionate, maybe it's just simply the work that needs to be done. Irene, I will turn to you.
Thank you so much, Carolina. I'm very excited to be here today and to be able to talk about this important topic. As you know, as you've said, women's health is a very important topic. It's heavily underfunded and under-researched. Women are underrepresented in clinical trials and medical research. And so the work that we do at the Society for Women's Health Research, based in the Washington, D.C. in the United States, is to really build awareness for these different conditions that either disproportionately, differently, or exclusively affect women, and then also to make sure that there's enough federal research investment in these endeavors. It's so important to me personally, or I guess there's not a particular moment, but as I've been doing the work, just seeing the impact that it can make. And so I gave an example, I think when we were talking before about having a friend that jumped on one of our webinars learning about fibroids, and we developed a patient toolkit for women who have uterine fibroids and helping them to navigate their care and understanding the disease and how to engage in the healthcare system. And we really wanted to highlight all the different options for treatments that were available just short of hysterectomy. And so there's a lot of other surgical and medical and lifestyle approaches and treatments. And after that particular event, she messaged me maybe a week later and sent me a screenshot of a brochure that her doctor had now given her. They had only talked about hysterectomy prior to that. And after this event, she went and she talked to her doctor and said, well, what else can I do? And they gave her now options and they discussed it. And so just the idea that women really do need this empowerment. And we say, oh, is there any competition? There is not enough out there. So there is no competition in this field. Every bit of information, every event, every program is so much needed. And so that's why I'm here and continuing to be in this space.
Thank you, and great to have you here. What about you, Caroline? Was there any specific moment? And
there was a specific moment when I had decided to up my game on campaigning for women's health, and that's when I got legislation through the UK Parliament. But in the run-up to that, what I discovered is that menopause, which is where I am most passionate, menopause is probably one of the least acknowledged and looked after symptoms that and conditions that a woman will go through. We lose women to the workplace because they can't work through their condition. We have women reducing their hours. There are women involved in the criminal justice system because of the menopause. The domestic violence increases in menopause. Women don't go for sort of promotions in menopause, and on and on and on. So menopause is the one issue that actually affects every area of social policy and certainly affects the economy. And I campaigned on this for quite a while. And the more I campaigned, the more I realised what little was known, not just amongst healthcare professionals, but how little knowledge women had about what was happening to their bodies and what was happening to them. So a lot of women were thinking they'd had nervous breakdowns. I was one of those women who thought I'd had a nervous breakdown. I was on antidepressants for 8 years, thinking I had mental health problems. Women thinking they have early onset dementia, fibromyalgia, a whole host of different conditions. There are more women who are on antidepressants than there are on HRT. And we know that a large majority of those women shouldn't be on antidepressants. They should be on HRT. But there's a massive lack of information. There's a massive lack of awareness. And there's a massive lack of support for women out there. So back in 2021, when I was first talking about this in the British Parliament, and I was listening to women, and I managed to get something that we call a private members bill, which is where you can try to get a piece of legislation through, but it has to be done in a short space of time and as least complicated as possible. And I thought about introducing workplace menopause policies. I thought about forcing medical schools to actually put menopause on the curriculum, because believe it or not, 41% of medical schools in the UK have not got menopause on the curriculum for health professionals. And it was in a conversation with a colleague who lives in England that it suddenly dawned on me that women in Wales, Scotland and Northern Ireland have free prescriptions. Hence, they were having free HRT. Women in England pay for prescriptions, so they were at a disadvantage. So whilst I never intended for HRT to become the dominant part of my private members bill, what I really wanted was to raise awareness. But once I managed to convince the UK government to give women in England an annual pre-prescription certificate, which allows women to access HRT for £20 a year for all their medication, the outpouring of interest globally just blew my mind. And since then, we've campaigned on every aspect of women's health, especially menopause. We're currently pushing that all women have a 40+ health check, which includes menopause. Because currently, if you have a 40+ health check, it doesn't even ask you how your periods are.
Mm-hmm.
So that is my mission, and that's the dawning to my awakeness of all this.
Very important, and yeah, what you're saying, the numbers about the 41% of the schools actually like having the menopause on the curricula, that's quite shocking. But what about you, Esther? What's your path?
Interesting. I'm going a little bit before Caroline. I'm a midwife by training, and I've worked clinically as a midwife for over a decade, both in private and public healthcare facilities in East Africa. And what for me the most defining moment has been is you can have all the technology in the world, but what women need pre, during, and after labor is really skilled healthcare attendants, midwifery, but also healthcare attendants. And to be able to give that, good training is needed. And that's not all up to date everywhere globally. And Africa is a big part of that. And I think technology is crucial in the advancement of health. And technology and AI needs to be incorporated in the curriculums within health, also to reach more healthcare professionals, but also to be up to date with the new technology changes, innovations. And as the previous panel said so beautifully, innovation without implementation is a waste. So making sure that it's part of the curriculum of healthcare professionals, not just midwives, but all healthcare professionals, is needed. And really to add to that, healthcare professionals are not going to be replaced by technology and AI, but healthcare professionals who are not using technology and AI will be replaced by nurses who will. So for me, it's crucial to ensure that curriculums are up to date globally with technology and innovation to have more impact on women's health. And of course, it's all health, but I think women's health specifically needs a special attention, because it's women have different health needs, and we need to approach it differently. So my passion and my way towards Techquity is really ensuring that this is incorporated.
Thank you so much. And this is a very good bridge to my next question to all of you. Esther said that the technology is crucial, and it feels that right now we are in the turning point when the technology and then policy can either bridge or widen the existing gaps. And from each of your perspectives, so some are more research, practice, and then policy here, what do you see as the most immediate priority to advance health equity for women through technology or policy initiatives? What would be the priority? Who wants to start?
I'll start with that and say that in terms of to make healthcare equal, we have to make sure that the medic's understanding is, as Esther said, is universal, and everybody understands what symptoms are. What we are currently seeing is that women are presenting at doctors with possibly 4 to 12 appointments before they're actually being diagnosed with menopause. They'll get diagnosed with all different symptoms, different ailments. In the UK currently, there are about 15,000 menopausal women, and less than 1 million of these women are actually on medication or support or treatment because of the lack of awareness. The priority needs to be that all medical professions, everyone involved in the game, from occupational health to practice nurses, need to have a basic understanding of what the menopause is, so that when a woman presents with specific symptoms, rather than back and forth to get a diagnosis, that she's actually sent straight away to a women's health nurse or whoever to actually say, yes, this is the menopause, let's try you on medication. Currently, without that lack of training, and that training, yes, it'd be brilliant if they all had if they had the actual physical training, but this can all be done through technology, through a series of questions which you can't pass on to the next stage unless you've answered all the questions up until that point, would be greatly useful in diagnosing more women as menopausal or perimenopausal.
Thank you. So we need some technology solutions that would help in this process of
to replace
evaluation
the actual training. So if doctors are not trained or nurses are not trained in the menopause, if they were asked a series of questions before they could go on to the next page, as you were, on the computer system and finish the consultation, they had to have asked and got an answer to specific questions.
Thank you. And
I think to add to that as well, and something that comes out very clearly is harmonization of these platforms, harmonization of the information is crucial. And yes, that needs to be specified on local context. You can't copy paste. But currently there is so much innovation happening, which is fantastic. It's not known by everyone, and it's very fragmented. And I think having a platform whereby all these different technologies and are harmonized is going to help a lot. Then it comes to policy. Policy is different. You need to put policy in place. However, AI technology, it's changing so rapidly. You also don't want to break or stop technology from growing. So it's a very difficult line. And I'm not saying I have a solution here, but there's some things we definitely need to be aware of, and especially if we do create these platforms, to ensure that we keep the growth in mind.
Mm-hmm, mm-hmm. You know, it's funny, I guess somewhat of a non-traditional answer is, I think the biggest priority is to be humble. In healthcare and policy, we talk about being an expert. And so there's this idea that I have to know everything and I have to be right, but we really need to humble our expertise to be open to relearning what we don't know. And so that's the only way I feel like we're going to be able to move forward, is recognizing that women have been excluded, that we do not have interventions and medications that appropriately address women's health issues, and that through the use of technology, we can identify these gaps, and we have to analyze a lot of this data. We have to pull out the data by sex, by gender, by different groups. And so, yes, women might be included in clinical trials, but do we actually address looking at sex differences and impacts and effects? That way, we can relearn. And while we say there's, let's say, a typical presentation of a condition or a disease, and we say it's atypical when a woman presents with a particular symptom of heart disease. But if women are the majority, then that's not actually atypical. It's only atypical of what we've learned, but not atypical of the population. And so I think just being humble across the policy side, across the medical side, across the research side, and recognizing what we don't know, what we've missed. So we're open to relearning this new information and actually implementing these changes.
And I would add to that, Irene, that we need to stop stigmatizing women's health and stop the taboo around not talking about certain aspects of women's health. I mean, we were late talking about periods. It's only something now that we're really talking about periods as a normal phenomenon. Menopause is something that a lot of women don't want to talk about or admit to, but society didn't like talking about it. It said, you were old, you're on the scrap heap. And that's just not true. And until we stop demonizing these conditions as something we're not going to talk about, then we will not have equity.
Yes. And I think here is also I think call to action to the whole of society, right?
Yeah.
To the men to recognize it, but also to women to speak up about this and not be afraid of talking about it.
Yeah, but if you think about erectile dysfunction, from the time somebody decided to actually produce a pill to it being available over the counter, Viagra, it was 2 years. It's 2024. How many years have women been on this planet since the day that the planet was created? And only now we're talking about the menopause. We're not the first generation, but we need to be the last generation that's afraid to talk about what we do to support women right to the end of their days.
Caroline, yeah, and we are talking about menopause, but also not in every country we're actually talking about this. I think that here the UK is leading this discussion. For example, in Europe, I come from Poland. I don't think we have this topic does not function in the public.
Need to get me over there.
We need to get over there, yes. But I wanted to come back to Irene. You said about this need to disaggregating the data for by sex and gender to make the healthcare more equitable. What do you think are the barriers? Why it's an issue? What are the barriers to actually making that happen in, I don't know, in the US healthcare system or in general, and how we can overcome this?
You know, I'm a researcher. I understand the challenge of getting enough individuals and representative data samples in your studies. And so you hope for the best, you want 50%, you want equal distribution, and you may not get it, but you will never get it if you don't design your study intentionally to identify those groups and then learn what these different populations need. And the reason why I say different populations, because not all women are the same. You know, whether it's geography, whether it's income, whether it's access, whether it's age, whether it's race or ethnicity, you have to be very intentional. And I think we have information at our fingertips nowadays in a way that we didn't. And so we need to utilize it to share information, to learn about the demographics and the populations that we're looking to serve, and to intentionally design studies. Because it wasn't in the US until 1993 with the NIH, or National Institutes of Health Revitalization Act, where studies were mandated to include women in their medical studies, in clinical trials, and then to report also by sex. And so doing this data analysis and reporting and disaggregating that data by sex. And so prior to that, you could just loop it in. And so it's more than just checking the box off and saying, oh, we had 40% women, that's good enough. Oh, we had this group in 30% or what have you. But really, why do you want them? Why do you need them? And then leveraging all the tech that we have out there, all the information sharing, all the platforms to really learn, understand these individuals that we want to serve, and then designing our studies to not only recruit, but to retain them. And so we use tech to target people for marketing. I don't know why we can't do that for research, for healthcare, right? I think we do it to make money, but we don't do it to save lives.
Thank you. And I think, yeah, exactly, save lives. I think that the main issue here is actually safety, right? For me, for example, the turning point was, I don't remember what was the book, but it was about the data bias in clinical trials. And it also exposed that some medications, well known, are actually like not very safe for women in the doses that are prescribed, because they were never tested on women. And for me, that was like eye-opening, that, whoa, there is an issue. I would like to maybe switch a little bit from that into talking about the partnerships and touch with you, Esther, on the issue of the local and international partnerships and how to create those communities and coalitions to advance women's health. You work with the Coalition for Women's Health in Africa. It would be great to hear a little bit more about that initiative and how that advances women's health in the region. And because of that, you are also in the forefront of addressing regional health challenges. And how do you see the partnerships between local and international organizations advancing those tech-enabled solutions? What are the gaps that those partnerships might help fill in or solve? And how to develop those partnerships that they actually work. Yeah, a lot
exactly.
Of
and again, it's all about harmonization, platform creation. And I think to explain, so I work for Africa Health Business, but Africa Health Business is the secretariat of the Coalition for Women's Health in Africa. It's a private sector initiated coalition, really looking at creating an enabling environment for women's health in Africa through partnership, collaboration, advocacy. I think Irene said it also so beautifully, like design studies so that different population needs come to the forefront within local context. And I think that is, again, so clear. We can't just copy paste certain technologies. That's also why policy is so difficult, because policy will be different in every country. But I think these partnerships, especially international and local, are so crucial to make sure that you have all the latest innovations coming to the table, but whilst listening to the local context. Creating these, again, it's all about going, I think, we're looking very much at it from global to regional to country, make sure that every level is involved to ensure that open communication is there. Now, these platform creations are difficult because you will always miss people out, and because you cannot reach everyone. And as everyone knows, time is limited in one day and in a year. But I think to look forward is really have those different levels, global, regional, local, platform levels speak to each other and really make sure that private and public is in talks as well. We don't need to reinvent the technology. It's already there. Most of it is there, but again, we need to implement it. How do we implement it? By listening to the experience that's been held, looking at the local context, and again, then we look at the design of studies and of populations, data collection to make sure that we really understand what is needed. So for me, having those platform levels there with everyone talking to each other, we should be able to do that with all the technology available. That's my way forward, I think, and importance in these partnerships. So yeah.
Thank you.
It's a difficult one.
Caroline, I imagine that as a member of parliament, you have to build coalitions and the partnerships around your cause. And we were talking about UK, but also going to other countries. What would be your message about this building partnerships and the coalitions?
Well, I mean, I really think that in the UK, the partnerships between individual campaigners and the platforms that they all bring have been the foundations of us getting what I term as the menopause revolution. So there are a lot of small grassroots communities who have come together on the one mission. So they originally, they all sort of started working in silos, identifying different aspects of for the menopause, in my case. So they would have one group that would focused entirely on getting doctors trained. There was another group who were focused on trying to get awareness for women. There was another group who were focused on, and so on and so forth. So what we tried to do was to bring them together so that nobody's working in a silo, but everybody's working for the one big outcome. And now they still got their individual autonomy over the bits that they want to take responsibility for, but there's one big united voice. And using social media, it's the only time I think social media is a good thing is when it's used for this kind of thing. The rest of the time, I wonder about social media, but that's another story. But in terms of and celebrities, a lot of celebrities in the UK have come to this and used their profile and talked about their problems, their situation, and used their platforms, and that's massively brought together. And this coalition now has become a club, if you like. We all seem to be at the same things. We all go to the same things, but we're all taking that message. We're taking it locally, we're taking it regionally, we're taking it nationally, and we're also taking it globally, because what I tell you, they will tell you somewhere else. We're all singing, to use a really old-fashioned phrase, from the same hymn sheet. And we all think the same, because what we are offering is the answer to the problem of how do we deal with menopause. Because the way that women in this country and globally are learning about menopause is from other women, normally on social media platforms. So they look into the platforms for the help and to ask the questions that they can't ask their medical professional, because one, the medical professional might not recognize it, or two, dismisses them and says, you've just got to get on with it. It's a stage of life. There's nothing much you can do. I've heard women being told, what did your mother do? Whatever she did, ask her advice. I mean, come on. We shouldn't be giving women that kind of advice. So that's where we work together. And politically, I've not met a politician who doesn't agree with me. Not one. Whatever political party they're in, they've all agreed, and they all work with me to make sure that we move this agenda forward.
Right. Thank you so much. And we actually have the question also coming from the audience. Thanks for everyone contributing here. I have a question, like, how can we actually incentivize quality outcomes for women? And hear that people make decisions contrary to knowledge all the time, and people misuse tools all the time. Do you want to comment on that? How can we incentivize quality outcomes for women? I don't know if here we can talk also about the value-based healthcare, or how to make sure that we actually develop the solutions that help women.
I mean, I can only talk about the apps that I know which are currently out there, which allow you to plot your symptoms. And if you take a printout of those symptoms to a GP and you tell them, the GP, that this has come from a credible source, if they don't understand menopause, they are more likely to actually issue you with the medication you need to tackle the symptoms. So most doctors are coming to the realization, because they don't know it, they take an advice from doctors who set themselves up to be the informers of women. And so, that, I mean, I myself started going, private healthcare in the UK is not something that we all actually need to do, because healthcare is free. But with the menopause, a lot of women ended up going privately, myself included. But once I had that diagnosis from the private medical profession, I took that to my NHS doctor, who now has absorbed me as a patient, and I get my medication free. So it's all about using it to your advantage.
And I think to add as well, and of course, super important to highlight the neglected women's issues, and I think the same for miscarriages, for example. Again, a subject that is not often talked about, but also going back what Irene said, really understanding the population needs, women's needs within that population is crucial to create quality care. So really understanding all these women's health issues that actually, and there's many that have not been highlighted, is crucial. And that's, I think, where Irene is so right with the sex difference in research. It's so important to have this research done to highlight and understand these health issues for women to create quality of care. And I think that's that real start. We have so much lacking data, and not just women and men, but looking at the African continent as well, very different health issues and health needs, again, for women as well, also very different approaches. So understanding these health needs is, I think, the base of creating quality care. So yeah, that's where I really would like strengthening in to make sure we can enable that environment.
Mm-hmm.
I agree with both. I mean, to incentivize, well, I know in the US, I wouldn't even necessarily call it incentivize, but maybe make more equitable or reasonable.
Yeah.
You hear for certain conditions that women have, the reimbursement for procedures is not there for healthcare providers. So if they want to, they struggle in providing the care and getting compensated accordingly from insurance coverage and, in those codes. So I think looking at the infrastructure as well in how we code for different diagnoses and conditions, and then what is covered and what is not. I think you hear a lot of times that women's health that's a personal issue. Yes, it is my personal issue, but it is a societal challenge to address it, because a personal issue for 50% of the population, I think, is a little bit more than personal. And so
Correct.
we have to, I think technology can really start to leverage this data, and how can we pull together to get the numbers, because that's how you get the change. You have to show the numbers, you have to show the impact, you have to show, everybody wants to know, where are the dollars going, where are the gaps, what can we save, what can we make, what can we build? And I think being able to pull that together and identify those resources and leverage, different algorithms, whether it's, on the machine learning side, if it's on the data side, how can we leverage that information to support this case? Because we know it to be true, but we just have to. I think we know it to be true, in all of our homes. I don't think there's one family that can say they do not know someone personally, a woman personally, who has had to wait longer than she desired to get care, that has been sent away without understanding what's going on with her body, that took medication that you later found out was not dosed correctly because of being a woman.
Appropriate.
And so we need to make sure that we're leveraging our technology in a way that best serves, really all individuals, because I'll just throw this nugget out there, but while it affects women and women's direct health, women also make up to 80% of the healthcare decisions for their family. So when her health is not good, when she is off, she's not able to make decisions for her family and her community. And so it affects the health of children, it affects the health of men, it affects the health of elderly. Women are 2/3 of the family caregivers in the home. So it's not just a personal health issue. It's a grand challenge when it comes to health of the general population in society.
On this personal issue, also my colleague always say that, well, everyone has a mother, and most of the men have also wife or daughter. So it's not that personal anymore. It's actually wider than this. Is the whole of society issue, right?
And I think also, sorry, go on.
I was just going to say 51% of the population are women. 100% will experience the consequences of women's health.
Yeah, correct. And I think I always say health and business need to go together, because people listen more when they're talking about monetary value. So we always need to change it also to imagine the money saved within the whole world if women's health is fantastic. And yeah, that's something business and health need to go together.
So, okay, I hope Esther is still with us, but still
to make sure people listen to that monetary value.
Okay, thanks, Esther.
Sorry, can you hear me?
Yes, we can hear. There was a bit of lag, but we are good. We're good now. Just very shortly, if we can touch on the issue of actually, I think Irene said leveraging technologies. You, Esther, talk about the value and also like making sure that we are actually covering the ground. What can we really do to and Esther, earlier you said technology is there. We have some solutions. We have some. But how can we actually scale it? Like how we can bring those innovations to scale? Some ideas, some suggestions.
I think it's the $1 million question, isn't it? I think it is happening. Scaling up is happening, and I think more and more ministers, and I'm talking now African context, right? More and more policies are being put in place. Ministries of health are aware, and actually, it's being put more on a regional level platform to ensure that, again, as I said, that different countries are aware of the different innovative ideas. It's scaling up is really difficult because you constantly scale up, but the policy needs to follow, and the policy needs to not be too tight so that the innovation can still grow. But for me, again, the platform level discussions are happening within on the regional context. So, for example, the Africa Digital Health Network is a perfect example of really bringing together these innovative ideas together in conversation with ministries of health. But for me, scaling up is really something that needs to be done, again, regionally and in country. In Africa, and this is very different, right, than the UK, health services, about 50% given by private sector and 50% by public. So it's a very big difference. And I think what is happening here with the scaling up, and it's interesting to watch, is that the private sector obviously is often a little bit more advanced in already scaling up, and thereby having these platform level discussions, public actually can follow much easier. But again, as I said,
sorry for interrupting. You see, Esther, also Caroline said that she went to the private sector to get some care and some services. So I think it's also happening in the other healthcare system. We have 5 minutes.
Okay, sorry, one quick, it's basically, we always say as Africa Health Business, we shouldn't be talking about by private and public. We should talk about health. And then we can look at. And so, but what is happening with more innovation coming and faster coming into private, it also elevates public. And that is not bad. And that will help scaling, but it needs to be governed by ministries of health. And I think what we're seeing here is that is happening, and that is exciting. But scaling on a very large scale is still very hard and needs still some more regulation.
Thank you. And we have 4 minutes to go. So I think we have one last question to each of you for the closing, for 1 minute intervention. The topic of this summit, of this Digital Health Society Summit, is like how we can modernize healthcare so that in 5 years it will catch up on other sectors when it comes to digitalization. And I would like to ask you to look into the future, into those 5 years, and tell me what major policy or technology-driven change you would envision that would help women to get better quality healthcare, better equity in healthcare, and better quality healthcare. What would that be for you? 5 years, one policy or technology-driven change, and 1 minute from each of you.
For me, I want the policy that every decision made by every government department takes into account the consequences of that on menopause or menopause on that. And the reason why I say that is because when you have 81% of women on, vast study that was done here of women the same age presenting with the same symptoms. 82% were on antidepressants, 8% were on hormone replacement. How much money have we wasted in medication? How many of those women are on long-term sick because they can't work, or they're afraid to work, or they're prohibited from working? So the economy suffers. How many women are involved in the criminal justice system because of a situation that may have arisen because of a symptom of menopause? So unless all government departments look at menopause and the consequences of it, then we're never going to get women's health, and we're never going to get the right social policy to make sure we look at all areas to make for a more prosperous and proactive society.
I'm for it. So +1 from me. What about you, Irene? What would be your change?
I would say we need policy for women's health, not politics. And so we need to support platforms for trusted and neutral information, because right now, I think because it's so fragmented, it's hard to find what you need to find. You see more gaps and more unanswered questions, and some of it is out there, but it's just lost. And I think we can really leverage technology to bring that together, whether it's health data, claims data, economic data, research on drugs and therapeutics and treatments and outcomes. I think those types of platforms and that data needs to be able to be shared in safe and open spaces, and it needs to be neutral, politically neutral. Women's health is not a political issue, but it's an issue that does need policy to support it.
I support that, even though, of course, like in every campaign and also the recent campaigns, that has been such a political issue. But let's not go into that. Esther, a change that you would like to see.
It's very alike what Irene said, but for me, it's on the technology platform. So as Irene said, information universally available. Sorry. I would like all technology that would advance women's health and tailored for women's health, and particularly reproductive and maternal health care. I would like that to be available or visible on a scale that is globally, that people can access, can understand. I have this issue as a healthcare worker. This is my population. What tools are already available up to date? It doesn't mean you have to immediately be able to access them, but you need to be aware of them. So that's for me, really that platform that we can immediately look up. This tool is available and it's working already.
Thank you so much. Thank you, Esther. Thank you, Irene. And thank you, Caroline, for joining us today for this very important session. I think full of energy, full of very important messages, full of calls to action. And I hope that all women who are listening to us and with whom we work and live will join this cause, will speak openly about those important issues, but not only women, as we agree, this is not a personal issue, this is all of the society issue. So we also invite all men to support this and support their mothers, daughters, wives, partners in fighting for or working towards more equitable health. Thank you so much.
Thank you, everyone. Thanks, Irene. Thanks, Caroline. Thanks, Caroline.
Thank you all.
Right.